Medical Group YouTube program. Today we're talking about America First or the Affordable Care Act. Which one? They're two different things. And Dr. Gawain wrote about it in his blog, Dr. Green Knight, which I do have a link to that in the description. We welcome all of our participants who are here with our live production of this on a Monday afternoon at 4:30, which is when we normally do these, Pacific time, 4:30, with Dr. Gawain and myself. Dr. Gawain he's not here yet, but he is with patients, so that is why we allow him to be a little tardy today. He'll be going over your comments and questions when he gets in, and those of you who are watching this after the fact who are wondering what's going on, we actually have people who chat in during the show because they're able to on the YouTube app. And you can follow the chat either during the live show or even after. There's a way to mark on your app to allow the feed for the actual comments. If you want to be able to participate in that in the future shows, you need to activate notifications. That's a little bell icon on the Auburn Medical Group channel in YouTube that will allow you to see those. So, to give you a little bit of background about the Affordable Care Act and America First health plan. The Affordable Care Act was often referred to as Obamacare and became law in 2010. One of the very important features of it, I guess I don't have to wear this while Dr. Gawain isn't here doing it. One of the very important features of that act was to protect patients who have pre-existing conditions. So this could be some kind of a chronic, I think I hear him coming, some kind of here he is. I'll put my mask back on for Dr. Gawain. Oh, I think the door's locked. Dr. Gawain, are you coming?
Yeah.
There you are. We have all these people waiting for you.
You locked me out.
I'm sorry. It wasn't just you. It wasn't personal. I wasn't picking on you.
Oh man.
So I was just telling
Did
you
they get
about,
to see you without your mask on?
I did all the big intro stuff, and I'm talking about the Affordable Care Act
Ooh, all right.
in 2010, and that the pre-existing conditions part of it was an important advance.
Absolutely.
We noticed that the executive order signed by President Trump called America First Health Plan says that the HIPAA, Health Information Portability, Protection Portability, is that privacy?
Yep.
Protection or privacy? Anyway, HIPAA with two P's. It was to protect pre-existing conditions, and in the actual executive order it says, oh, it already covered that. It
Back
protected people with pre-existing.
96. Yep,
in
we
96.
still needed the ACA.
And we did, and the reason was because it did
Right.
not protect against that for everybody. It was a very specific condition under which it did, not universally. So we had people who would have their insurance run out or would change employment. And if they had diabetes or congestive heart failure or rheumatoid arthritis or lupus, they could either be denied coverage or they wouldn't be able to afford the premiums.
Right.
And so they're the sickest of the sick, the people who you can most make a difference in by spending healthcare dollars and keep them from getting worse, were not getting care, and in fact were getting worse, and healthcare costs were climbing for many reasons, but this also contributed to it.
Yep.
The ACA, the Affordable Care Act, got rid of that. And we, as physicians, we can tell you the difference we saw when the ACA went into effect.
Yes.
We saw a different way to practice medicine that was good. And this is what it was. If the insurance companies are on the hook for the long-term good of their patients because they can't kick them out or raise their rates just because of their pre-existing conditions, the insurance companies have an incentive to keep the patient well over time.
Right.
So we saw things happen. We
New
saw
things. We'd never seen these before.
Well, maybe we had, but
To not to the extent that, yeah.
no, not to this extent. So we saw insurance companies putting in as standard parts of their policies to pay for screenings like mammograms for women,
Yep.
like colonoscopies for men and women, like screening for chlamydia, screening for
Pretty
cervical
much
cancer, pap
All of-
smears.
Yeah, all of the USPSTF recommendations.
All those things that if you catch it early, you can keep somebody from having cancer or something else.
Right. Mm-hmm.
Also, they were paying for the annual wellness visit
Yep. Every year.
that
Once a
hadn't
year.
even existed for Medicare patients before that. Or did it? Yeah, I don't think it existed before 2010.
I never used it before that.
And then what was the other? Oh, something else that's come along since then, which is only with Medicare, I believe. Things like chronic care management through our office,
Right.
or primary care offices, and remote patient monitoring with the blood pressure monitoring, the blood sugar monitoring, oxygen weight
Right.
outside of the office that's now covered to keep these patients well. All of that is stuff that the insurance company is paying for to keep patients better so they don't have to pay for this patient's emergency department visits or hospital admissions or ICU stays down the road that we're going to avoid by having this care. So I will leave it to you to decide to describe what's going on with
Where we're at.
Health or America First Health Plan, which was an executive order
Yeah.
described in your blog.
Which you should check out.
Link to
for
it
sure.
in the description.
So let's roll it back just a little beyond that and actually see why this came up in the first place. So I'm sure everybody's aware Ruth Bader Ginsburg passed away a week ago Friday. And with that, there's an open spot on the Supreme Court. And the Republicans, Congress, and President Trump are moving forward with putting on a new appointee. A conservative appointee, and for the most part in the past, the conservative side of the Supreme Court has ruled against the ACA for the most part. So that's just
Not completely.
not completely for the most part, but let's keep that in mind. So there's that one thing. There is a lawsuit case that is coming before the Supreme Court on November 10th, California versus Texas, where the state attorneys general of various states are suing. I don't even know exactly how it works, but essentially, they say back in 2017 there was a ruling, not an executive order by President Trump to make the federal mandate for healthcare that you needed it no longer viable. And that was an important part of the ACA too. If you did not have health insurance, you would get a penalty. Some people argued for that. Some people argued against that. I won't go into that. They each have their merit. So that is coming up, and that's coming up before the Supreme Court. So people have argued that if this part of the ACA, which is now not law, actually against the law, as shown in the executive order by Trump, that invalidates the whole law, the whole ACA. And if the Supreme Court chooses to, they can rule against the ACA and essentially say it's invalid and repeal it. That's a big thing. So I guess to reassure people, last week on Thursday, I think it was. I think it was Thursday. Anyways, President Trump put forward his plan. So he his whole goal here, he needs to shore up some of his voters to reassure them that some of these things from the ACA are not going away. So he put forth this America First Healthcare Plan. And in this plan, he laid out many, many different things. And truly, many of them are very good. And one of them is that we will still have coverage for pre-existing conditions.
Okay.
So there is the extended background behind why this is now an issue and why this may become an issue in the future.
There's particular wording, though.
There is.
The way it was worded about the federal government protecting people with pre-existing, it's their responsibility, I believe, is the way it's written.
The federal government will now have the responsibility to protect those with pre-existing conditions.
So
it was, yeah.
What I don't like is it's not the same language as the ACA.
Right.
And it makes me very nervous about all these things that have been contributing to improved health for patients.
Yeah, we see it. I mean, we can truly say that part of the ACA is a good thing.
I am very nervous about what would happen because the wording's different. Now, in my reading, I have found that up to this point, it looks like the court would not strike down the entire Affordable Care Act because of one part of it.
Not this time. That's what I would say.
So we're hoping it doesn't, because we're seeing good things in our patients and patient care without knocking the whole thing out. With the only thing to put in place, this executive order that was just done last week. And there were some other things that have been executive orders before. I think like 4 of them all at once a couple months ago.
Yeah,
There
were a bunch.
Some very good things conceptually. Not clear on it working out. I hope it would work out for some of those things as far as drug prices and such and generics. Good stuff. Stuff we really do want to have happen.
Right.
But not a comprehensive plan like the Affordable Care Plan had in place. That there would be an awful lot of people slipping through the cracks, and cracks is not a good word to use for how major the deficits are if we have that one executive order replace the Affordable Care Act.
Which is reams of paper long, and has a lot of intricacies. So but the ACA had its problems. I mean, we need to admit that, and we'll freely admit that. We're not all over it. The whole promise that you could keep your doctor and then that not living up or panning out, that was a problem. Prices going up, that was a problem, but it could have happened anyways. We don't have a control study there, unfortunately.
Although we do know how much prices were rising before and how that decreased after. We do know that the price increase every year got squelched down. Yeah. Which was quite something to
it changed, it changed to the new, more high deductible health plans. More of those became available. So it kind of changed the way you use your health insurance. But so it brings us to an impasse. Let me see if I can't bring it up here. I'm just looking at comments, which are great, by the way.
We're going to find out
but
in the coming months.
So these things, it's going to be interesting. So let's talk about a couple of them specifically, these things that President Trump laid out. So one of them, people with pre-existing conditions. That needs to stay. I mean, that is a bare minimum of any healthcare plan moving forward. We cannot leave people out to dry at all.
It needs to be done in a specific way so that no insurance company can increase the rates because of pre-existing conditions, nor can they deny coverage because of pre-existing, nor can they cancel coverage. These are all very specific language that needs to be kept.
Very specific language. Yes, absolutely. Thanks for clarifying that. Another thing is surprise billing. He made a mention that we should not have surprise billing. Yes, absolutely.
Please.
People should not have a bill that they were not expecting from some reason, out of network or whatever it was. Yes, that should not be happening. Here's the thing. Congress has been working on that for 1 or 2 years now with insurance companies, and they haven't come to a resolution. So I'm curious how that's going to play out. How some executive order is going to do something, and
that's what some of the criticism is.
So a lot of this executive order is not so much an executive order, but more of a here's my general plan moving forward without specifics. So we need more specifics to know actually how this is going to play out. And then as an aside, I found this interesting. One of the things was to send every senior in the United States a $200 gift card, not gift card, but credit towards medication
expenses,
which is great. But the optics of that 1 month out from an election, Anyways, I thought it was funny.
Yeah, it's one way to address the high costs of medications, and he's also addressing the high cost of medications.
There are other ways
through those other executive orders,
absolutely, and those need to be addressed for sure.
Not letting the drug companies charge Americans more, than they're charging people from other countries,
which is ridiculous. That's just ridiculous.
So that was from the previous executive order.
Charge more.
Comments and questions?
So that's what. Yeah, let's go to some questions. Thanks all those. A little shout out to all of our channel members: Bianca, Teresa, Roa, Lindsay, and Twine. Thank you.
Oh my goodness!
Appreciate
all three
it.
of them.
Hello
Very
to
good.
all of you. So let's see here. So somebody was making a comment about, I could not afford the Affordable Care Act. My premiums kept going up, says Terry Humphreys. Yep.
Yep. Yeah.
So
we hear that. We
yeah.
do hear that.
Yeah. And one of the issues with the ACA was the exchanges. I mean, those didn't work out too well. The state exchanges, those
Right.
have pretty much been worked out at this point. But
Yeah.
there needs to be some sort of stopgap or something that catches those people who are kind of right in that
The
middle
in-between.
area who can't afford their premiums.
Yeah,
but
there were a
don't-
lot of people that were affected by
Yeah,
that.
but aren't in the Medicaid
Yeah.
range. So, yeah, again,
Yeah,
specifics.
Even the ACA isn't.
Oh yeah,
it's not the end product we need.
It's got its problems,
No.
but it was a
But
good.
I'd prefer to start from what we currently have.
Let's throw out all the bad stuff, but keep the good stuff, like we should do with
Kind of.
everything moving forward, right? Anyways,
Well, that's kind of what it is to
that's
keep the
sound.
pre-existing conditions and get rid of the rest of it. That's sort of what that is.
sort of. But there were so many other parts of the ACA that
it's not
that-
comprehensive
Yeah.
reform. It's patchwork. I guess it was wholesale disposal of it, but just not a comprehensive plan
Yeah.
replacing it.
I think for the most part, it is a reassurance moving into an election that, hey, and I hope that it pans out. That hey, even if I get a conservative justice on the Supreme Court, we're still going to have coverage for you people out there. I am hoping,
Yeah, we hope that's
a
what it
big
is.
reassurance.
If it were to happen,
Right.
yeah.
Mm.
Still a little nervous though.
Yeah, yeah, it has us nervous. Let's see. Like, what happens if you are knocked down and unconscious and they take you to hospital out of your insurance? Wait, for 3 days, and when you wake up, you tell them you have no insurance and can't pay. Oh, hey, that's an interesting thing about America compared to the National Health Service.
Yeah.
You go into financial ruin and essentially go bankrupt.
Yep.
Welcome to America.
Which is a thing. Medical bankruptcy.
It's one of the leading causes of bankruptcy
Yeah.
in the United States.
Yeah.
So
Or-
that's interesting that you bring
Yeah.
that up, Bianca, being from from England.
Yeah.
So
Yeah. We know what happens for her. If it
yeah,
ever
we know what
happens.
happens
Yeah.
over in England if that happens,
But,
right?
but here, not good.
Yeah.
No.
Right. Something needs to happen. I mean, we're unfortunately a socialized, Medicare for all or anything like that doesn't look like it's on our horizon. I think even if we were to get a Democratic president,
No, it's not going to be that.
yeah.
No.
Some of our candidates were running on that platform of Medicare for all.
Right.
A lot of the Democrats were discussing that, but
Yeah, I don't see,
We'll see.
either of the candidates right now for president. I say either because I really think realistic. We're only talking about two parties here this year.
you can vote third party.
I don't think there's a significant option for third party this time around.
You
And
don't need to be tied to two candidates. Let's tell them. Let's do it.
by wasting our votes.
You can say I waste my vote all I want. I don't like choosing between two evils.
Between two evils.
Anyways,
Wow. Okay, so
there's
he's
not a good choice. The Libertarian,
Oh boy,
Oh,
I don't know. I don't even know who the Libertarian candidate is, so I can't.
Joe Jorgensen.
I,
Duh.
yeah. Okay. Huh.
Yeah, no one has heard of her, unfortunately.
That's why I said what I said.
Yeah.
So I'll say it again. The two candidates, neither of them really has something that I am just dying to see happen healthcare wise.
Yeah.
It's not a huge comprehensive plan.
Right. Yeah, we won't really be
Like the
voting
Affordable Care Act was.
based on any
Yeah, I
medical
don't
side of the equation.
I don't see an option for everyone having everything they want a year from now for health insurance, and I apologize that we don't have that right now presented to us. I think a lot of the fires were put out with the ACA. Not that new fires weren't created.
Right. Somebody makes a comment here. We pay insurance to have them take care of our bills as needed through insurance. Why are we having to pay a premium or copay? Well, because that's how if
Why
you
are we having to pay a premium?
well, the premiums to actually get your insurance. The copay
gonna
is
say.
just part of the how insurance works.
Copays, interesting thing about copays. Those that study these sort of things have found that when copays are present, patients, even if they're small, will not spend as much money for the benefit, and therefore that keeps the costs down quite a bit compared to how little the copay is.
Right.
So it does result in you having those lower premiums in a couple different ways, not only because of the amount you pay, but also because of the disincentive for getting every little thing done that the insurance may possibly cover.
Right.
Which you can look at that two different ways. You can say, hey, that's health care. Why are we not, making it available for health care? But we know on our end that there is some stuff going on that patients get done and happens that just isn't all that
Isn't needed.
cost
Yeah.
effective.
Right.
And
Well,
if they have to pay
yeah.
a copay to get it, it's a little less likely. For example, going to the emergency department for something that
Could have been taken
absolutely
care of.
could be taken care of in the
Right.
office.
Mm-hmm. Absolutely.
But, it's convenient to do it now instead of later. Not urgent where something medically needs to go. So people are making decisions based on their copay, not the medical urgency of the situation. And it's not because they don't know. It's because it's convenient.
Right.
It's that sort of thing that the copay helps to kind of curb and decrease costs for everyone.
Right. Well, yeah, and if you have a high deductible health plan where you are on the hook for everything up to a certain amount, that really will affect your choices. I mean, I have a high deductible health plan. I know if I go to the ER, it's going to be a $500 visit, easy.
Everything.
Where if I go to my primary care,
when you say
couple hundred.
you have to pay for everything with the deductible, everything except for those
preventive
covered
care.
preventive things.
Hey, what do you know?
Now, the insurance could cost less if those preventive care things weren't covered and you just paid those out of pocket and just had a higher deductible. That would actually cost less for everybody. But here's the problem. Nobody does it. People just don't, I shouldn't say nobody, but enough people don't get their preventive care when they have to pay for it as part of their deductible as when it's a covered benefit. And it makes everybody's health care costs higher
Right.
when we don't have it covered, which the Affordable Care Act was one of those things that got those. So that's another thing we like about it, is that coverage for those preventive services.
Right. Yeah, because in the long run, people are going to be healthier, live longer, have less medical health or poor health outcomes.
Yeah.
I guess you could say.
Okay.
So, yeah.
Any other comments or questions?
I'm sure there are.
He's sure there are. He has confidence.
Some people are saying that the Trump executive order is more a political thing, which one could argue for sure. Yeah.
Nothing new though.
Sorry, bring it up. Yeah, that's about it.
Okay. Hey, thanks for the comments.
Yeah, thank you for being a part of the conversation.
Yes.
Appreciate it.
Thank you to our channel members. Thank you to.
Right.
And who else thank you to?
Yeah, over at drgreenknight.com, I kind of go into this, my opinions on it, and point towards some of the things that may be a little iffy moving forward. And it's kind of interesting. I've had some feedback from both sides of the equation, Democrats, Republicans, conservatives, liberals, and they have their opinions on both sides.
I believe that.
So I tried to
I
stay
do not doubt that.
as neutral as possible. So go over and check that out, drgreenknight.com. I would like to thank the patrons over there, Teresa Roa and Boo Boo Kitty. Thank you for what you do. You make it happen.
And also thank you to that same Boo Boo Kitty, and also to Lindsay and Twine, who are on the Dr. Vaughn Patreon. And as always,
I'm Dr. Wayne Vaughn.
Dr. Mark Vaughn telling you to stay in good health.
See you.
And thanks for joining us.